Radiation.
मैडम को जैकेट दे दो मैडम. But it is very heavy, madam. Second. थोड़ा मदद कर दो. मैडम को भी. बाकी सब रेडिएशन है.
Especially unmarried ladies, please, when the radiation is on, try to turn to the other side and put your both the hands on the uterus and the ovary. Please. At least you have some protection.
So, madam, you may please.
अभी बात तो कर लें.
बाकी तो सब मेल ही है. मेल प्रेगनेंसी है.
Male also. Yes. See, we wear this up to the knee joint to protect all our organs. Very important.
Papa, nothing is there. 100 hours we are protected without jacket. Nothing happens.
See, one lady I was working in Iran, she had renal stone. And the doctor doesn't know, he wrote KUB. Kidney
KUB.
they advise.
Excellent.
So when the child born, there were no hands. Multiple exposures. Direct. So heavy radiation it comes.
But this machine does not have very heavy radiation. No?
100 mH.
All machines are same.
Sir, this gives around 6 mA only, but continuous. In X-ray, we will have 100 mA. That is instantaneous. This is continuous. Intermediate. ఏంటంటే లైవ్ ఇమేజ్ వచ్చినప్పుడు హైగా వెళ్తుంది. 6 mA ఇంటూ 60 seconds క్యాలిక్యులేట్ చేసుకున్నా కూడా దట్స్ ఏ హై.
उतना मात्रा को ये सो मेट्रो की वजह में
This is ABS technology, sir. Automatically it will take the MA depending upon the patient.
तो आपके पेशेंट बन जाएंगे.
Patient, sir.
So कहाँ बोल रहे थे अपन?
Iran में तो.
So that child
Without lips.
no lips, both. And other patient came, she also had this one X-ray exposure. So she was very much depressed, and she was trying to do abortion, but nobody was doing it because the Islamic country they don't accept.
So one thing you can do, you can ask that lady to stand behind the madam. That girl, na, those who are afraid, yes, you can stand behind the madam during the exposure.
Come.
You can stand behind the madam. Yeah. Those who are afraid of exposures,
Then
they
I
can
will not
stand.
expose much. I just show you the anatomy only. Then when you put the needle, then I will show you how to.
Next session, let us take 10 aprons. 10 aprons will take it. Better.
At least 6. They have to
Yeah.
provide 6. These things.
Yes, that's what I
इसके साथ 6 देते हैं हम लोग.
नहीं पापा.
नया के साथ आता है, sir. नया machine के साथ आता है. This is the imported. इसके साथ.
So that second lady she came to me, sir मैं ऐसा X-ray have taken, मुझे भी शायद वैसी बच्चा होएगा. She was so much depressed, and she told her son to jump on the abdomen so that she will abort. But abortion will not occur so easily. So then I gave her about 1 month leave. She was a teacher. I called this her husband also to take her out, go to some seashore, spend some time. Nothing will happen. One exposure will not cause anything. But she was not accepting this one. But she had normal delivery and normal child. So that is important. How many exposures you have? See, as far as possible, try to avoid
X-ray.
MRI, CT scan.
CT.
Because one MRI is equal to 100 X-rays.
Papa, one CT.
So much of radiation.
CT. Am I right?
हमारे तो magnetic
MRI does not have radiation.
CT scans.
CT scan.
Scanning, sorry.
scan.
So try to avoid that scans unnecessarily. If patient is having 6 months old CT scan, other thing you can accept and go according clinically. Very important is clinically.
Clinical.
Indians, we are trained like that. Mostly we go clinically, not according to the. But in foreign countries, what they will not see the patient first. First they will say, here are the
Reports.
report. Once you go there, first you will write all these things, 50, 60. You get all these things then. And after getting the report also, you will not see the patient. You will not talk to the patient also. Sometimes. And they will prescribe. That is not. In India, we are trained like this. First, train your hand, fingers, how to diagnose clinically. Then go. So be careful about the radiation and try to be away from this thing, this radiation. See, it will not come up to that distance. Only 2 to 3
Table 2
feet.
to 3 feet.
Circumference, only 2 to 3 feet it comes. So nothing to worry if you are saying the other side of the field. So
वो बॉम्बे वाला पेशेंट ले लो ओए आओ परसोत्तम
आयो ऊपर
अरे बात पे मिस हो जाती है. वो निकाल दो सीधे डाल. अरे क्या नीचे एक मिनट.
वहाँ नीचे वो है
बस बस सब
केबल फिक्स कर दो. पुरुषोत्तम केबल को फिक्स कर दो.
वो नीचे तो वो बंद कर
टाइट कर
लॉक कर लो
ठीक है
वहाँ से होगी बीच में
So one day, one of our cardiologists, his son-in-law working in the US. He is a anesthetist. So he came to Hyderabad to my hospital for some. He said, "I will do epidural for one patient." His father is a cardiologist, so he brought one patient. He is a very famous man. So we took him to this cath lab and you made me sleep. So they do this procedure in the prone position. When he was doing the procedure, I asked him, "Have you taken the consent?" "No, sir." So I said, "First take the consent." Luckily, I reached there. So the patient was in the prone position. So under the CM guidance, he was looking and going down. He approached the epidural space. After approaching the epidural, test dose of CC medicine was given. Died. He collapsed on the table. And literally he died. I was just behind the mirror, I was just looking at him. Then when I saw, totally gone. Prone position, heavy patient personality. How you will revive? When I came running inside, I took the patient like this, turned him like this, heavy, and holding this thing, mouth to mouth, I gave this patient. I said, "Come on, immediately, emergency." Nobody was there. Only oxygen cylinder. I was taking that oxygen in the mouth and blowing his mouth. You have to give the oxygen. He was sweating like he came out from the bathroom, and then no pulse, no. Immediately some other doctors became. Then we gave other injections and we kept him for 24 hours under observation. So sometimes unexpectedly these things will happen.
So Papa, which is the first choice of drug you will choose in this condition? Which will be the first choice of drug you will choose in this condition?
नहीं वो
इस कंडीशन में आपने कौन सा ड्रग चूज
नहीं
किया
आजकल तो बहुत सेफ आया है.
उस दिन आपने कौन सा चॉइस किया था
आपको याद नहीं है. But this is for dye.
Reaction to the dye.
हाँ, reaction to the dye. तो आप just observe it, but unnecessary don't practice in your clinic and don't land in trouble. Okay, spinal shock, very dangerous. It happened many times with me, but this is common. It is one of the complications
Spine
of
anesthesia.
anesthesia. Before giving anything, patient will collapse. Spinal shock. So we have to get ready every this thing. These are the precautions you have to take. And always, if you are giving any paraspinal injections or thing, always keep adrenaline, atropine, hydrocortisone, atropine, and some of the other medications, emergency medication. And don't use adrenaline in a hurry. First, give only atropine. Atropine 1 milligram or 1.2 milligram is the regulated dose. Atropine is very common and we have to keep an emergency box always in our clinic. Any patient, hydrocortisone, and always have IV line. Suppose if you are doing all these things. But as far as possible, try to avoid all these complications, unnecessary headache. If there is any problematic case, before it becomes worse, you talk to us, me or Shastri sir, will guide you. Or for few days you send him here, we will treat him, then we will send him again we will send him back for further management and we will guide you on what to do.
See, there are two things what Papa means to say here. First of all, these procedures are not meant for you people. But we are trying to change your mindset that these procedures can recover patients. The first mindset about us is that extruded disc needs surgery. Even his brother went for a surgery and now then he is suffering from pain. Whereas we have treated thousands of patients, even now you have seen, I have treated thousands of patients with extruded disc and patients are having what? Pain-free life. Today also one patient came, he went away. I'll try to call him tomorrow. You see his spine, there are two discs extruded. He could not even walk from year to year, right? And I tell you, he's a very excellent teacher. I just learned epidural in 30 seconds. He came, little the pakdo, yahan ghusao, ho gaya. I said, wow. And from that day onwards, I've given, you can see the box, more than him, I give epidural. So my saying is that, see, two things you have to remember. Learn dry needle procedures. Wet needle procedures you should not do because it is a work of experience. Since he is here, I can take the courage. Because my father is with me, anything goes wrong, we have emergency doors. I also know, he also know. We put and we revive the patient. There was one patient of Parkinson who did not even pay us money. What did he give? His father was suffering from COVID, post-COVID complication. He gave a beta blocker. As a result, the moment he gave beta blocker, he had a bradycardia and next day we saw his heartbeat was 40-45. Saturation was going down. By giving him atropine and dopamine, neoadrenaline, we gave 3 straight, right? And we survived in 24 hours. Next, he was normal to the bed. But see, one thing I tell you, treating any case, see, one thing we must understand as a neurophysician or anyone you are dealing with, progressive diseases. Once you have a stroke, you must understand you will suffer from Parkinson and Alzheimer's. Because neuroproteins are going to be generated and these neuroproteins will eat up the neurons and it will destroy the patient. Before such thing happens, see, 1 month, 2 months is nothing for patient's life. Right? How much months of your life you have wasted in your life? Now if I calculate, if I see your treatment protocol and your treatment style, you have wasted how many years? Your whole life in treating a patient and you could not recover patients. Am I right or wrong?
Right.
But whatever gone is gone. Now whatever is there. Learn properly, do things properly. People are suffering. Don't cross your limits. See, one thing I tell you, whatever is homeopathy you can do, you do that. Don't try to run under allopathic lines. Because tomorrow there is a case, court case in consumer court. right? The compensation is how much, 1 crore rupees.
Minimum.
Minimum. Apollo Hospital, right now, the Consumer Court chairman who appoints judges to the Consumer Court, he told me a very good statement. What you know? Apollo Hospital had to pay the money to the patient up to his retirement, and it was more than 80 crore rupees. How you pay, court is not responsible. You have to sell your property, you have to sell your jewelry, or you go to imprisonment. So, procedures, I do many types of procedures, right? What I have learned from me, from IP Cherian and all. But that does not mean that I do this here. I do some of the procedures very silently, very coolly, and when I see that he is here, Papa aale? Then I'll do the procedure. Why? Because if any emergency is there, I have a cardiac anesthesiologist. Right? Now if you think that this muscles will not, this is what? This stiffness is what? Paralysis. No, it is something damaging with what? Deep inside the neurons. If you do not recover this right now, what will happen? This is a what? This is a case of Parkinsonism, not atypical Parkinson. You see, the hand, leg, everything is okay. But your case has gone in atypical Parkinson. So what we decided, we refer the tendons, right? Under CM guidance, skull injury can be recovered in what? Whatever we can do, let us do. But my advice to you is that you people do not cross your limits. You must know what you can do, what you can. See, learning is important because you can understand that by doing this procedure, this can be achieved. But that does not mean that I am a vegetarian, I saw chicken cooking and I started eating chicken. Right? So these procedures we have, I requested him to show you. Tomorrow also we will show you some procedures. So today he will show you clavicle block and all in his father, how needle goes inside. And in his case he will show you spinal block and all. होगा epidural दिखा पाएंगे? You like? So those who are female, madam, आप उनके पीछे चलेंगे.
Even when you do needling also, patient may go into shock.
Yes.
It happened with me 3 months back. One patient, young boy, 28 years, he came to me. I made him to sit and I gave some on anything. I gave some needles, 4 needles. So he said, sir, I want some water. I was afraid by the time I get the water, it may fall down. I ran inside and brought the water. Then when I was I just holded him. So he sink off. I know what to do. Immediately remove the needle. I lifted him from the
Elevated face.
and put him on this thing and elevate the limbs, lower limbs, so that the blood will reach. For the shock, total circulation will sluggish and the blood flow to the heart will go. So at that time, what you do? Just put the legs, raise it up to 90 degrees. The blood will come to the vital organs, brain, heart, kidney. So that is important. Whenever patient goes into syncope, wherever on the road also, just make him sleep supine and this thing elevate and jaw thrust yourself. Open the mouth. Because once you become unconscious, and will fall back. That will upset the airway. Just open the mouth. Hold it. Lower and back side of the mandible. Just physical jaw. Extend the head. Just put the finger here. Only one finger. Both, if you put it, it's very good. You can't put at least 4 push it in this angle, it's open like this. Then he will take like this. That is sufficient to.
This is very important. The moment you open the press it, the mouth will open. Tight, this one. Press it tight. Immediately the patient will come out from the shock. You have to be very careful with the vasovagal. This leads to that.
No. ఏం చేస్తుందా?
ఎర్రర్ వచ్చింది సార్. 2 minutes.
ఒక 5 నిమిషాలు కూడా పెట్టదు కదా
సార్.
ఓ 5 నిమిషాలన్నా
అంతే సార్.
పని చేస్తే వరకు 2 నిమిషాలు వచ్చింది.
అయితే ఆన్ చేయలేదు సార్ 1.5 months నుండి. మాయిశ్చర్ వచ్చింది.
अब वो लास्ट टाइम जो मैंने किया था ना उसके बाद हमने इसको वही मेरे को ये जापानीज मॉडल मिला उसका ये साइज के लग दिया ये जब अपना ओटी रूम आएगा और जब बच्चे लोग आएंगे तो इनको अब ये सीखा ही नहीं पुरुषोत्तम जी से सीखा ही नहीं कहाँ से सीखा है कल तो एकदम फैला हुआ दर्द था ये इधर से लेके इधर तक वो कैसा है
ये है सर अभी इंजेक्शन का नया ये पार्ट में ये इधर पे पूरा पेन है इधर से इधर ये पूरा पेन
अभी बस तो एक ही प्रोसीजर करना अपन को कम हो जाएगा
अब समझ में मैंने क्यों बोला बेटा महीना भर लग जाता है चीजों को खोदते 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 एक दिन में खुदाई नहीं होती बेटा समझ में आया बेटा सेविंग मनी इज नॉट सेविंग
क्या हो गया?
See, one thing you must remember, saving life is important than
This is your
sir आप क्या ना old age है तो CM is not advised for you अब पेशेंट है क्या करेंगे पार्किंसन पेशेंट है आप बाहर बैठिए
One Parkinson case 2 months back she was here uncontrolled she was just doing walk right lower limb and upper limb uncontrolled and another case of scoria from childhood she had scoria but her IQ was very good तो करे ना लड़की को she is 32 years but she is engineer
वही अभी किया बाबा हंटिंगटन को रिया
तो आई लड़की आई थी हाँ तो for my this is I said ऐसे कोई improve नहीं हुआ but what her brother told sir ये काफी better है अभी she has more than 50% 60% improvement now she is able to type she is able to eat with her hand always बस dancing वो बताया हमको
वो डांसिंग वो भी देखा ही है
हाँ वो तो खैर वो तो क्योंकि भाई बर्थ है उसको it will take long time and this Parkinson's case you did in 2 months. I never expected so fast.
Even in this case, Papa, he came with this old man. In 3 days, yeah.
I have given him medication and we are doing acupuncture. He will recover.
You already recorded. He started climbing straight days. Today is the 3rd day.
No, we have got very good herbal medicine. I prepare myself and we do acupuncture also. Both simultaneously and they recover. Good results.
The herbal injection.
अच्छा.
Herbal injection also I give.
Okay.
I prepare. Especially this bed sores, wound. Those cases. You can see one patient here for
I'll show you central pondymyelinosis.
505.
We'll bring this patient after this one. You'll see that case never recovers. This case continues because it is called central pondymyelinosis. It is because of hyponatremia. So this patient, even correction of the sodium, they never come up with what? Coma scale. So we recovered that patient in coma in less than 10 days.
I have very good drops. If you put the pair or put 2 drops in the nose, in 10 minutes you will see the patient will open the eyes. What happened with the patient 505? You ask son. And such a big whole bag was.
We all know that we need a plastic surgery. But then,
So it was brought by a specialist doctor, MD physician.
you see na Avinash.
He brought it. So after 1 week, मुझे सर आप क्या करती है अब इतना एंटीबायोटिक दे रहे, इतना ड्रेसिंग कर रहे, नहीं हुआ, लेकिन वीक्स टाइम almost 50% it has come. You ask her son because they don't tell anything like. वो तो सही बोलेंगे ना. So it is now more than 60 to 70%. It now needs some skin grafting and this put on the
Skin damage.
Huh?
Skin grafting.
No, we'll not do any skin
We are doing
grafting.
here, but if they go to hospital, they will definitely do that.
We will recover that patient without skin grafting, just with this medication, and conservatively you will get the what? Without wound. So in many cases this center is a higher center because we have recovered most complicated cases. You could have seen they have done right now you got a call from America, right? What did they say? They have already done the nerve transplant and they have done one of the best place of therapy phone I have. And they have gone to where? Langan Medical Center, which is number 3rd or 4th in the world. They said nothing can be done with the child. And then I said them, you go to my Facebook and you decide. They said we have already decided that you are the only one in US and India who can revive this child. If you cannot revive, there is no recovery. And now you see what is our tool. Maximum tool what we have is Papa 1. Maximum. Or else dry needle and how much I give you a sin? Less than 0.5 ml. You seen or not? 0.5 ml or 1 ml. If you think I have injected 10 ml of Papa 1, did I do that? पापा की रोटी के साथ पानी पिला दे.
Recovery, paraplegia, hemiplegia.
Quadriplegia.
Quadriplegia चाहिए.
You are sick today, Kolkata patient. How are you?
Quadriplegia, gunshot injury. One patient came from Saudi.
No, Somalia.
Somalia.
Somalia is only.
Total transactions.
No, we have recovered the case. Okay. Take time.
But they have shown recovery. Now that patient after 17 years, on 4th or 5th day, he has started walking. Today also I will show you after brain stimulation. How he is walking. Without question when I go to his room, he said, "Okay, will I walk today?" Walking.
Muslim patient, he was trying to jump into the water. He jumped in the water. He had a cervical injury. From that time, he developed quadriplegia. Saudi had the treatment and everything. वो यहाँ सर मैं कब रिकवर होता हूँ, हाँ कैसा होता हूँ, ये जन्म में तो नहीं होंगे आप, हम पिछले जन्म में फिर मिलेंगे पिछले जन्म में. But when he came to me, you have recorded me. Sir, he was telling, अभी मुझे मालूम है, I am feeling, मुझे सेंसेशन यहाँ से यहाँ तक आ गया, और ये पूरा जो है ना सर, मैंने सीट इन द कार में जो मालूम ही नहीं रहता कि मेरा इफेक्टेड है. अभी I am able to feel. जब हवा लगता है तो सेंसेशन आना है. That is within 2 or 3 months. That is the progress.
You see, we have purchased his Siam in how many hours? Morning he came, next morning we installed it. We are just waiting for our PNDT license. You see all, you are buying ultrasound, you are buying 120. We thought of 16 slice CT, but that day CTVA surgeon came, he changed my mindset and I said, you are purchasing 128 slice CT, so that you can learn CT guided procedure. See, teaching you this procedure is that how much a dry needle is going, and you can practice this procedure with confidence and without creating any negligence in your.
Last week was orthopedic surgeon came to me. His wife is a anesthetist. He was literally crying. Really, he was crying. 100% you will recover. क्या प्रॉब्लम है मुझे पहले बोलो. सारा 10 साल हो गया. I went to so many doctors. कोई छीता ही नहीं पहले तो because I am a doctor. Nobody touches me. वो बोलते you know what to take. हाँ वो बोलते पहले MRI करा दो स्कैन करा once you bring that scan or the thing there is some problem in the lumbar and sacral region you know the please all of you try to sit down or you will take 1 or 2 time
नहीं कितना टाइम लगेगा बाबू?
Sir, 5 minutes.
so 10 years
बाबा परसों तुमको तो दवाई प्रिपेयर कर देगा आपका
थोड़ा जरूर के नाम
XY
वो है ना पपिया की
Reverse patient.
अब वो असलियत वही करता है
वो एपिड्यूरल में कैसे जाएंगे?
इसे गिनीपी बना तो मुझे लेना
बाबा एपिड्यूरल में तो
ठीक है तो in 4 days this total cervical pain is 0 no pain 10 times I asked ऐसा नहीं हो सकता 10 साल का दर्द इतने जल्दी कम नहीं हो सकता नहीं सर मैं झूठ क्यों बोलूँगा 4 days में उसका सर्वाइकल अभी 50% लो बैक पेन अभी है सर एंड आई गॉट 10 सिटिंग सीके और 3-4 days back came sir मुझे 80% relief है now I confident when they came they said they want to go to July one son is in Germany other son is in America they want to go wives always quarreling with you तुमको कुछ नहीं हुआ तुम अच्छे हैं तुम बहाना बना रहे he cannot sit for half an hour he has to go and relax because of the तो मैंने उनको थोड़ा ऑयल बना कर दिया ड्रामेटिक इम्प्रूवमेंट अब नो स्पाइनल दिस थिंग लंबो सैक्रल रीजन 80% he himself is very
See, most important thing, one thing I tell you about him, why I respect him, because he taught me the best thing is the drug toxicity. He taught me what? Drug toxicity. I never learned in my life, because always we were famous for using high drug. He was the first person in my life who taught me with 0.25 milligram of ketamine how you can sedate a patient. With 0.5 milligram, and this protocol was applied where? In Karat. When I went to Karat and other places, I saw the anesthetist was using in ICU 10 milligram, 20 milligram of metazolone, 10 milligram of metazolone to sedate the patient. I was saying, what is this, sir? You can sedate this patient, and I saw they were giving very fast. Within less than 30 seconds, 10 milligram of metazolone was done. I said, just give me 1 minute, let me try. Less than 0.5 milligram, the patient is sleeping. I said, you take it out. If the patient wakes up, then we'll give 0.5 milligram.
lesser the dose of molecules. In 10 milligrams, thousands of. If you give half milligram and dilute it, give it very slowly. 3 to 5 grams. It will penetrate into the tissues. And what result you see? Why do you want so much of drug? Side effects of the thing. So, lesser the drug, very good effects and cost effective also.
In my pre-depression period, I hardly used to take 0.5 milligram of metazolone before my mother's death. And it was more than enough to give me 6 hours sleep. Papa used to come, he used to take only 0.5 milligram and used to say, Dekho jadoo. The moment he said jadoo, the word jadoo is completed. I am already sedated. And I used to get up after 6 hours. And then I asked him, what did you give? He said 0.5 milligram of meta. I was amazed. For first few days I said, he is lying me, I never believed it. But then what did I do? I took myself when I used to take cocktail and salines when I used to be weak. I used to tell these people, you put 2 milligram of metazolone in the RL and let me see what effect it has. I saw before the half bottle is finished. Huh?
First 10.
I'm already sedated.
Last 10.
In 500 ml of. And that is the best part of his practice. I saw that he can do larger surgeries with his own cocktail. I never knew about him. We met in a seminar, and after that I never know about what he is, what he has practiced. But when his friends came and told me, "Oh, Mohan Singh is here," Bola, yes. "Oh, you learned from Mohan Singh?" Bola, what? He's the only physician who can do 6 hours surgery in local anesthesia. The most part is that as a physician you must avoid as much drug as you can, because this drug has a toxicity and it destroys the liver and the gut. And once gut is damaged, the patient's recovery becomes most difficult. The best part of Papa I like is what you know. Out of the way, I should not call him Papa, but the way our relationship, in a single day I did not call him sir. Because the most important part of him is that he taught me such procedures which changed my whole method of thinking. What? That lesser the drug, now if you see, in the most critical cases also of epilepsy, we give how much? Even if you can see in this case, I am using more higher drug than him, but if I ask him how much he is using, Jalocan, less than 1 milligram. And the patient's effect, if you see in his procedure, what you have to learn is the way how to give, not the number of drugs you have to mix.
One thing about the Xylocaine, you have not seen any reaction of the Xylocaine. Many times surgeons they give local infiltration for any small procedure. By the time they put the syringe here and they see the patient gone. So you should be very careful about giving Xylocaine also. First, most of the time surgeons what they will do, they will give local. You go to dental procedure, na? First they will give some Xylocaine, they will make you to sit for half an hour or 20 minutes. Then they will give you. So many times it happens with me also. When we do the block, the tourniquet was not tight, so the whole 500 milligram went inside. This happened in Saudi. It's a very difficult. There is a medical legal case. So I could immediately, I understood. Patient was getting convulsion. This thing. Immediately I gave oxygen, sedate immediately. It took 5 minutes. Patient will take off. Only thing is you should know how to revive the patient. Otherwise, one day when the neurosurgery was going on, one child, the surgeon was delayed. After extubating, child has a spark. Patient, anesthesia, sir, इसको spasm हो गया, she fell down. She became unconscious, she fell down. Then immediately the surgeon, he took the mask and started ventilating the child. And child recovered. So it is a part of our game. Anesthetist, patient will have cardiac arrest, hypoxic, and you should revive it. We can revive it. You should not afraid. अरे patient मर जा, मरने वाला तो कैसा भी मरता है. कोशिश तो करो तो.
बचते हैं.
उसको देखकर हम गिर गए. क्या होता? So next time they called me, and one brain surgery was going on. Till 2 o'clock we operated the case. So all the hospital director, everybody was there. मैंने सर आप लोग क्यों आए? हम लोग करते ना सर्जरी कर रहे हो गए. वही और ऑल हियर. मैंने मोहन लास्ट टाइम ऐसा हुआ हमारे साथ. इसीलिए हम क्योंकि लंबा सर्जरी है 6 घंटे का सर्जरी है कैसा रिकवर होता है. आई रिकॉर्ड ऑन द टेबल. मैंने यू कम एंड टॉक टू द पेशेंट. बोले सर हम कैसे है? आई एम हैप्पी सर. कोई दर्द है तो So try to understand very important things I am telling you because I came across in my life all these things. So revive the patient. उसके लिए आप in your clinic always keep the emergency medication, study, syringes, everything. I 6 sets I will keep all this shit. कहीं भी कुछ problem है, emergency box. When you open, I'll keep on always checking everything. In my clinic also I had that.
You see, I tell you recent incident. I took around more than 350 milligram of metazolom, 150 milligram of diazepam.
अब क्यों पूरा सुना रहे हो?
And then what drug he choose, you know? He choose one drug, I don't know, he should not sit with them. He said just give this, cardiac arrest will not be there. And you know, after taking that drug, right? I went to Chutney's, I had a breakfast, 11 o'clock. Whereas everyone was thinking I'll be in the ICU and I was treating patient by 11 o'clock. This is incident was of 5 o'clock. 8 o'clock I am in what? Chutney's. 10 o'clock I am in my clinic. So, say one thing I tell you. Medicines are both good and but it is your way of using. So you are coming here for 5 days. Don't think that you can start doing blocks and all. Block we are just showing you what?
Knowledge.
For your exposure.
Exposure.
See, I am buying neuromuscular, neurosurgical microscope. Am I going to do neurosurgery here? No. Only to change my mindset of doing microvascular surgery, to remove my depression, right? To learn micro stitching from him. What we decided? To buy
Microscope.
neuromicroscope. See, learning does not change anything, but it changes your mindset of accepting a patient. This may not make you good enough for blocks, but it gives you an exposure that how inside you go and how things are visible inside. Over a period of time, you can become a good expert and you can do it. Tomorrow I'll teach you with the help of Siam how you can give at least prolotherapy without Siam. Because today you know the anatomy, tomorrow you will know how to use prolotherapy. Prolotherapy is nothing but a combination of normal saline and soda bicarb at a very less quantity.
In one bottle of saline, normal saline, put
Yes,
just
sir.
1 cc.
1 cc of soda water.
And if you have hyaluronidase injection, hyaluronidase, dilute into 3 cc, put 1 cc in there. It will have very good result.
100 ml of saline,
100 ml normal saline,
1 cc of
soda bicarb,
soda bicarb,
and 1 cc of hyalase.
I guess.
Tomorrow we'll get highlights and we'll show you. See, if the pen is radiating over here, we'll find you all the trigger points and then we'll show you how to. Yes. But see, these things are with our own understanding, our own experience.
This combination I use in the eye surgery. Eye surgery,
कॉम्पोनेंट गया
5 cc xylopin.
क्या
मॉइस्चर्स पकड़ के कॉम्पोनेंट गया है सर।
हाँ
कल कॉन्फ्रेंस है ना सर?
हाँ तो आज नहीं होगा.
आज आया होगा सर। tomorrow morning we'll bring that and make it by 10:30 or
ठीक है. आज जब बाबा बैठा तो कुछ तो कर.
Blindly before.
You got it?
गर्मी हो रही है.
Sorry for everything. अब मशीन है मैं तो क्या कर सकता हूँ.
बेटा इसको कहाँ
और तो 2 नीले लगा दो 2 शॉर्ट हाँ उसको बोलो लाएगा. बाबा ब्लाइंडली हॉस्पिटल कैसे दे सकते हो. और एक क्लैविकल बॉक्स का कर दीजिए. हाँ बाबा 3 है क्लैविकल बॉक्स का बात और वो है बेस्ट पेन का. उसमें आप सीधा वैक्यूम लॉक दो. नी पेन है
भेज तो दिया
हाँ? नहीं
आज
पैकिंग दे दो
ना ना फोन ही में तो भाई ना ना आज ही तो भैया मैं कार्ड में हाँ
So see, one thing I tell you, the recovery of the patient for life is important. 1 month, 2 months, 3 months, or what? He has suffered for 3 years. Now what did he gain? The person who's next to you has suffered for 3 years. Post stroke case. They have gone to each hospital of Delhi. Name a hospital which they have not gone. And what is the recovery there? See, when the patient is in a stage of recovery, recovered. Once it goes out of the recovery stage, you can have only one thing in your eyes. What you know? Guiltiness and tears. And after some time, you'll become like me. I was a very strong man, right? You have not seen my strength. I can at a stretch, I used to work 96 hours. Monday morning, Monday night, Tuesday morning, Tuesday night, Thursday morning, Thursday night. And then also I used to say I can go 500 kilometers journey and again I used to come. You can ask these boys, in seminars I never used to stay for 30 minutes also. Continuous teaching I used to do. Right? But after my mother's death, the guiltiness I had destroyed my what? Complete life. They changed. A man who used to avoid sedatives, drugs, medicine, now I cannot, matlab, I have not become dependent, matlab, I have no other option. What will I do at sitting in the room? अकेला रूम में बैठ गया क्या करेगा? हाँ? इन दीवारों से बात करेगा और उल्टा सोचेगा मेरा कोई नहीं है मेरे को क्यों प्रैक्टिस करना है? I am taking ketamine only because of one issue that I don't want to think anything in my mind. Non-technical things do not come to my. The first thing comes in my mind is यहाँ पे भगवान. That is why Caesar took the decision of buying what? CT scan. देखो कितना स्ट्रेस लगा. This is a CT scan. Dates कहाँ आ गए तो अगर कितना आ गया. देखा कितना जोर से कोई नहीं आ गया. Within 2 or 3 days you can see him standing. So it's so easy to recover hypoxia and all, but the damages which you create because of continuous physiotherapy, continuous acupuncture, putting needle here, 10 needles here, especially this dry needling expert you see, and then this with this boy. But instead of recovering his scar, what did he do? He gave him traction. He is also my student. So don't tell him I said it. But then you see, without knowing you are doing something, and ultimately who is the victim? First I had to recover his neuropathic symptom. Then I said my father is with me. Immediately we start working with his scar. He told me I have only 15 days time. But I said at least in 15 days. Whatever it is we can give. उसके बाद 15 दिन के बाद में करेंगे. अभी 15 दिन का टारगेट करूँ. क्या पता है 15 दिन के बाद कहीं औषधि 40,000 रुपये जमा हो जाए. Work should not go. हाँ? और मुझे कितने पैसे मिलते हैं इसे बताओ. मैं फिर रिलेटिव पे मैं उल्टा लक्ष्मी नारायण जाता है. But मेरा भी एक ये कि भाई whatever money I make from this Zoom class, all this, what will I do? I'm no more. I thought of buying one Fortuner this month, but then I decided one side Fortuner, one side CT. I made my mind to purchase CT than to buy a Fortuner. This year we had three targets. I want to buy Fortuner with Mercedes and BMW. These three, after every 3 months I wanted to have 3 cars. 1 month car. Old habit. But then we converted it to what? Fortuner converted to CT. BMW converted to MRI. Other converted to neuro microscope and all. See, ultimately what we have to do is to change our mindset. That's it. Is the same dry needle you use? Is the same dry needle I use? I give only 1 ml and my patient is divide. अरे मैं इसको कल आने दो बाबू day after tomorrow.
फिर तो वही हो जाएगा बिहार में से दुल्हन बाद भी
कितने मुश्किल से तो उसको पता है
क्या दर्द हो
अब ऐसे ही तुमको दर्द हो रहा तुम सीधा सो जाए पतला सो जाए नहीं हाफ एन आवर हो तो तुम्हारा तो तुमसे कभी भी पूछ लो दर्द कैसा है दर्द है अब तुमको हम सीधा भी सुला दे तो भी तुम्हारा दाएं साइड में भी सुलाओ तो भी पेन है जब से भी रखो तो पेन है इसको ऐसे लेटे रहो तो भी पेन है तो है क्या से क्या हो गया एक गाना था आए हम क्या से क्या तारे सपने कहीं हो गए कौन सा पिक्चर का गाना है ये
गूगल बताते हैं
ये बहुत पुराना पिक्चर है उस समय का पिक्चर है कहीं 90s का होगा दूरदर्शन में देखा था मैंने सारे सपने कहीं खो गए आए हम क्या से क्या हो गए अरे सही हम तो पिक्चर तो देखने से ये मूवी से कम है
खत्म भी हो जाता 3 घंटे में ये
sleep apnea. I recovered his sleep apnea. Snoring भी recover करते हैं। हम लोग snoring की मशीन लाते हैं। IVF, IGF में सब डायरी लाइक करें। हम दोनों का बस एक ही बात है। हम दोनों जो है ना वो मुझे कुछ बताते हैं ना मैं उनको कुछ बताता हूँ। मतलब आप बिजनेस करो प्लीज नहीं वो इसी बात क्या करते हैं स्लीप ऑफ टर्न कर देते हैं बात करते करते बता देते हैं
बात लोग भी बता देंगे वैसे नहीं
आप अगर पूछने जाओगे तो नहीं बताएंगे अगर आप मतलब जैसे ये ओटी रूम में अचानक जैसे मैंने बात करते करते पापा ने बहुत बड़ा यूज किया नहीं बताएंगे सोचने लगते हैं ना नहीं होता नहीं तो अचानक से आपको सारी लाइनों को बता देंगे 1 2 3 एक एनेस्थेसिस्ट बोला था प्रोपोफॉल 4 मिलीग्राम से ऊपर मत लेना कुछ नहीं होगा 1.5 से कुछ मत लेना मैंने 4-5 मिलीग्राम मार दिया प्रोपोफॉल कुछ नहीं हुआ परेशान हो गया 5 मिलीग्राम मारा था ना ओए वेंकटेश कितना मारा 4 ना 5 तो बोल
हाँ
कुछ कुछ हुआ नींद आया फिर पापा ने बोला प्रोटोकॉल केटामिन लेने से पहले 15 मिनट पहले 1 ml मारो फिर केटामिन के साथ डाइजापाम मारो तो तुम जाके सो जाओगे ये सब बोला होगा पर आप मत मानिए ये आपकी बॉडी की लाइक नहीं है ये तो हम जैसे सीखे चीज विटामिन 100 मिलीग्राम हम जैसे ही खा सकते हैं और फिर 2 घंटे बाद 100 मिलीग्राम खाने के लिए तैयार होते हैं
पेशेंट होता है
ऐसे सही आ रहा है आईसीयू में भी आप कहाँ केटामिन
तो नहीं देते बहुत कम है तो ये तो भी
मैं तो केटामिन रोज लेता हूँ
दवा की आदत जोड़ दी है दवा आपको समझ लिया है दवा ने हाथ जोड़ दिया है
मैंने ब्रेन ट्रेन कर लिया आपने न्यूरोप्लास्टिक कर लिया
न्यूरोप्लास्टिक
अगर कब जब भी अगर आपको रात को लेक्चर देना है ना एक मिस खत्म करने के बाद सीधा 4 मिलीग्राम मेटाजोलम मारेगा
रात की खुल जाएगी
खुल जाए उसके बाद लगातार लेक्चर चलता जाएगा
चार देंगे
केटा नहीं दिया ना
तो 2 बजे भगा देंगे
1 बजे मेरे को मतलब हाँ अजीब सा लगा यार चलो बहुत फला है मेटा लेने के बाद मेरा दिमाग जो है
चमत्कार ही हो जाता है
चलता तब मैं
लेने के बाद तो चमत्कार ही हो जाता है ना
1 मिनट ये दो 3 केस करके करना तो ये बहुत इंटरेस्टिंग सब्जेक्ट है क्योंकि सबसे इंटरेस्टिंग ये बात है कि यू वर्क विद ऑल द डिपार्टमेंट्स ऑफ मेडिसिन ऑप्थेल्मोलॉजी से लेके न्यूरो ऑप्थेल्मोलॉजी से लेके ग्लूकोमा तो करते ही है करने को इसके लिए तो वो लाया हेरिडिटरी पिगमेंटोसा स्टेफिलोमा
आपको नया बना दिया
हां
मेरी भतीजी है
हाँ रिवर्स कर देंगे
बॉयफ्रेंड ऑफ द वाइफ
रिवर्स देते हैं
उसका नेक्स्ट टाइम मत बिहेवियर थोड़ा
तो दो रोज ही मिलता है ये लो पूरा
रात जब आएगी
माथा का देखो
माता नहीं
मैं वो यहाँ पे सब नहीं मिली ना
कॉन्फिडेंट लगा तो ज्यादा मिला
और ये बोलती है कि डॉक्टर बातरास की मेडिसिन से हो रहा है
डॉक्टर बत्रा होम्योपैथी वाला
उसने वाला
होना भी हो तो वो भी ना हो ठीक हो तो अगला केस कर
लाइव चल गया
यूएसआईटी का पेन है इसमें से आपको ये देखो सिखाना ही तो नॉर्मल क्लाइंट से सिखा दो स्टार रिलीज करना लो कैमरा का पोजीशन ठीक करना
क्लोज है
ग्लाउज दे देना यार तो ग्लाउज दो
7.5 ठीक है
देखो don't use excess alcohol to spoil the various minerals अभी तो यूएस में 20 साल पहले
बंद
से
कर
बेच
दिया है।
था यूजिंग alcohol
हॉस्पिटल में तो नहीं यूज करते हॉस्पिटल में नहीं यूज करते अल्कोहल
ऑपरेशन को हम लोग तो 7 नंबर लेडीज का लैब है 7.5 तो बंद करेंगे 7.5 नंबर है तो
साढ़े सात तो लो मैं तो 6.5 यूज
कार्डियक सर्जरी में हम क्या करते हैं पेशेंट को पूरा मेडिसिन लगा देते हैं मैं जो फिर सर्जरी की एक दिन में 4 दिन उठा के उसको पूरा मेडिसिन लगा देते हैं 2 दिन बाद टेकिंग तो होती 1 घंटा प्रोसीजर है तो पूरा ऊपर से लेके नीचे तक
सफाई
नीचे तो पूरा फुट तक बिकॉज
यहाँ से वो लेके भेज दे रहे हैं
हाँ
पापा 8 नंबर मोबाइल दो हाँ इधर को बोल दो मतलब सस्त्री है ना 8 की
एक बॉक्स वाले का
एक बॉक्स 8 ना जी मेरा 6.5 10 भी 6.5 के तो ज़्यादा यूज करते हैं
ये निकाल दो ना निकाल दो उसे निकाल दो उनको ये पोजीशन में है
हाँ
इधर ऐसा सुना फ्लैट हो वो हटा देखो यू मस्ट कीप द पेशेंट लाइक द चाइल्ड इन द रूम ऐसा मुड़ते रहता है ना वो पोजीशन में
कैमरा को बैठो प्रभु कैमरा को इधर लो
तो नीज क्या करना ऊपर दोनों घुटने मोड़
लाइट वाला दे दो
बहुत नीचे वेरी गुड
गर्दन नीचे बस
इधर वाला लाइट
तो वो किधर से आया दर्द है आपको बोलो हाथ मत लगाओ
पूरा नीचे जहाँ पे ऑपरेट हुआ ना सर
जी जी हाँ ये ठीक कुछ वो अपना निकला तो नहीं
कट शीट या कुछ
और एक है
जो ग्लव खोला वो ले लें सर
और एक ग्लव
नहीं जो खोला था 7 नंबर वाला
क्या दे रहे हैं
ऐसे साइड से
एलिवर फोन लगा होता है एलिवर तो मैं क्या हूँ
आज तो बड़े डॉक्टर हो गए
छोटे छोटे डॉक्टर
तो बाबा सोल क्या है सोल तो बता दो एक सवाल है जो मैंने इनसे पूछा है मोर देन 50,000 टाइम्स
ओनली
अभी पूछना है और बाकी है
रोज पूछता है
जिस दिन ओनली खत्म होगा उस दिन पता लगेगा
ये थोड़े से जा रहे थे ना नहीं बताने में अच्छा है क्योंकि बता के बाद में परेशान होना जैसे बैठ के भी कर सकते हैं या आप खड़े
खड़े।
थोड़ी ज़रा ऊपर करो अब आप लोग
उठाओ। और दबा ना धीरे धीरे स्लोली पूरा दबा
पूरा नहीं दबाना बाबू
हाँ ऐसे
ओडी में काम करता है टेबल पोजीशन पेशेंट पोजीशन
बहुत दिक्कत है बस बस
तो ऑलवेज अपना लेवल में रखो अपने अमेरिकन लेवल में रखना है रख के जस्ट फील द एंटीरियर पिक्युलर इलियक स्पाइन This is the anterior section. Then put your thumb here. Automatically it goes at the level of L3, L4.
Real.
Yeah. That's why he is having pain here.
Yes, pain, yes.
Right, na?
Yes.
So this case we will not do any doing or any. This will be a block because already the patient is operated here and the muscles are so tight. So मेरे भाई को तो इतना टाइट हो गया कि नीडल टेढ़ा हो गया. So once the muscle becomes fiber, tough, it is very difficult to pass. Rare cases, very rare case. मैं तो पहली बार देखो मेरे भाई डॉक्टर है वो, उनको लगा है तो सारा नीडल टेढ़ा हो गया. तो usually operation post-op cases में
His brother is a top pediatric doctor
ये दे
of
दो बाबा.
Hyderabad.
Spinal needle.
Spinal
उनको भी 50 साल का अनुभव है.
लोकल दे दो ना. ये नहीं ये है ना. हाँ. तो मेरा
पापा ये लोग पूछे थे आपकी उम्र कितनी है?
58.
ये नहीं यार.
आपने उसको छुआ हाथ सैनिटाइज किया?
हाँ.
देखो आपने 3 गलती की, बताओ क्या? अपने हाथ सैनिटाइज करके ये पूरा एरिया के पेंट को छुके वापस हाथ खराब कर दिया. वापस सैनिटाइज करो.
दे रहा हूँ. Sanitizer.
Don't touch the cloth of the patient. ये देखो. हमें तो ब्लड टच करके तो वही कर दिया जहाँ से चालू है.
बाबा हेलो, वो घुटना और ऊपर करो, पीठ पीछे करो. ये एरिया है पीछे करना. ऐसा नहीं,
पीठ बाहर
ऐसा
निकालो
नहीं.
थोड़ा.
घुटना ऊपर. हाँ.
थोड़ा सा.
ये, हाँ. तो लाइट डालो ना बाबा.
हाँ हाँ पेन के तो लगा रहे हैं.
This is the spine. Huh? Because of the fibrosis, is developed scoliosis.
लाइट जलाना.
लाइट चला बाबू, मोबाइल लाइट.
लाइट जलना.
हो गया, हो गया.
हो गया.
अवसर पेन.
बस 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 बस.
In one puncture, you can do the tight है वहाँ पर, it's not going inside. Then we'll change the direction. वो पूरा tight हो गया.
इसका एक्चुअली न्यूरोपैथिक से हमने खाली इसको लोकलाइज कर दिया. यू आर टोटली न्यूरोपैथिक केस.
फिर कॉटन दो बाबू. यहाँ रख दो.
ये
हाँ. See, the plasma is very painful. When you inject the plasma, patient इतना चिल्लाएगा. That is why
लोकल
first we use some local. So wait for 3 minutes. तब तक हम क्या करेंगे? अदर साइड यहाँ भी है वो.
यहाँ पे ऊपर मिडल का पेन है सर, वो ज़्यादा पेन.
ठीक है, ठीक है. इधर इधर देखो.
इधर भी नहीं.
इधर कर दिए ना.
हाँ सर, यहाँ पे वो पेन है, बहुत ज़्यादा पेन है सर.
जी जी. हो गया.
सर
कोई बात नहीं बेटा.
पेन सर.
बस बस हो गया भाई.
see 10 years of suffering. Post operative surgery. कैसे रखते होंगे ये लोग इतने दिन?
सर इंटेंसिव
Like 2 years back operated, 8 years suffering, 2 years post operative suffering. अब तो 10 साल एक्यूट पेन में कैसे रहा होगा ये बच्चा?
पहले हमारे पास आता तो इसको अगर ऑपरेशन
अब इसको मालूम भी कब पड़ा जब इसको पूरा ट्रैक्शन देखे उसके फिजियोथेरेपिस्ट ने मुझे बोला मैंने सब कर लिया सर मेरे हाथ के अब आपके मत से मारा मुझे तो मैं खुद ही बोला अब मैंने सब कर लिया था कायरोप्रैक्टिस से लेकर ट्रैक्शन लाइन रीडिंग सब कर लिया था मैंने बस कुछ भी नहीं करने दिया
ऑपरेटिव लीड में तो फायदा होगा
एक्शन
नहीं देखने को मैं भी क्यों लगी ना तुम
आप तो ट्रैक्शन को देखें
मैनुअल शिक्षा ताने भी कुछ नहीं
अभी मैं देख रहा हूँ उसको सैकड़म रिलीज भी नहीं कर सकते हाँ कुछ नहीं कर सकते
अब एक काम कर सकते
भेज सकते हैं।
अब भाई हमें भेज सकते हैं
वैसे अंदर मत कर लो मैं थोड़ा
बाहर निकाल के रखो थोड़ा सा,
पेन
लो वहाँ से पकड़ के रखो
पीठ बाहर निकाल के रखो थोड़ी सी।
पैर
बेटा तुम्हें पेन कब नहीं है मेरे को ये तो बताओ
कभी ज्यादा है कभी कम।
अभी तो कभी
रिलैक्स
करना गर्लफ्रेंड के बारे में सोच के कब जूता तुम्हारा
नंबर पूछो
नंबर
ऑनलाइन कर दो लाइव रिकॉर्डिंग में
भूल गया नंबर
नंबर याद
इतने बहुत है
नंबर कितनी है मतलब याद नहीं।
जब भी तो कमर में दर्द है
यस नहीं सर वो पहले से
लड़की
क्या
ने जूता
गर्लफ्रेंड
मारा
या
होगा ए इससे मारा होगा इसलिए स्वीट होगा ये सर ये इससे जूता खा गया है मारा होगा पकड़ के 3-4 इंच से
कि कमर दर्द लिए घूम रहा है
हाँ ये से मारा होगा एकदम
तभी तो
ठीक से।
एकदम बात है कि नहीं मैं चल रहा हूँ अभी
देखो आई एम इंजेक्टिंग दिस पीआरपी
तो इसका कितना अमाउंट देना क्वांटिटी?
बस 1.6
अलग अलग डायरेक्शन में
जैसे लोकल दिया वैसे।
नो यू सी देयर इज नो पेन
नहीं
अब पेन कितना बेटा
यस वहीं पर ही पहले सर
बोलने के लिए पहले वाला दर्द है या मिडिल का
मिडिल का पहला उसके बाद ज़्यादा ही
ठीक ठीक है
La 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 lori, lori, do बोलना करे कमाल अरे सुना ना बेटा तुमको ला 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 दूरी की कथा
पेन होगा सर
कहाँ सिर में या कमर में
अभी अभी समझ आ रहा है
अब
हाँ जी तो
मिडिल लगा तो फोन नंबर याद करने में ध्यान लगा तो कहाँ दर्द के चक्कर
लड़की की कमर की साइज कितनी है बता
मोबाइल में बनाया
अच्छा मोबाइल में है
और का कमर का साइज याद है क्या देखिए प्यार किया था कमर नहीं देखी ऊपर नहीं देखा
सर
क्या हो रहा है
पेन हो रहा सर
हो रहा ना
पेन ही तो हो रहा है
सर वो पेन
और तो कुछ नहीं हो रहा है
एनेस्थीसिया देके सब बंद कर दो उसके बाद कुछ करना पड़ेगा
दिया ना बाबा
पेन हो रहा है, सर।
तुम देखो एक देखो कार्ड इंजरी कितना डिफिकल्ट हो गया केस.
अभी हो रहा गलत.
नो सर.
नंबर याद आया.
देखो देखो. See, now I am approaching towards the nerve roots. दर्द जो आता ना nerve roots के पास है. Always aspirate that.
And see this is
कभी कभी क्या होता so superficial it is.
Fine. Fine.
उसको मजा नहीं.
सर पेन.
What I am using is all steroid technique है. बस आपको बताना बोल के मैं यूजिंग दिस वन. इसका बॉडी स्लॉट है उसमें. कल कौन सा साइड ये रहो राइट साइड लेफ्ट साइड.
सब जगह जी.
मोबाइल एक साइड दिया.
ये नहीं कर रहे.
लोकल दिया प्लाज्मा दिया ये आपके बारे में था.
एक मोबाइल लाइट मारो.
जब से बोल रहा हूँ कोई मार रहे हैं.
एक और दो मोबाइल लाइट. मोबाइल लाइट. मोबाइल लाइट.
गलत है नहीं ना.
नो सर. यस. पेन स्टार्टेड. यस सर पेन.
एक बहुत ही
इतने
बारीक
मजा
लेडी।
मतलब लोकल जीवन का आदमी
थ्री मिनट्स हम क्या करते हैं देते इमीडिएटली
कर रहे थे नहीं नहीं लेकिन पहला जो दिया था उसको तो 10 मिनट हो गए 10 मिनट हो गए
नहीं अभी थोड़ा देर है।
दबा के रखना पड़ेगा आएगा पानी
आप लोग वीडियो रिकॉर्डिंग में देख लेना वो। हो गया बाबा हो गया। टेबल क्लास
माइक्रोफोन
लेडी को भी प्रिपेयर करो उसका पापा का प्रिपेयर करो गंजी खोलो ये कर देगा क्या नाम है वो कर देगा ये कर देगा ग्लव्स निकाल लो
दो तीन बार।
अच्छा
लाइट बंद कर दो बंद
हो गया